The reality is stark. Tertiary hospitals are intended for complex cases, specialized surgery, advanced diagnostics, and conditions requiring expert management. Yet, everyday illnesses, minor emergencies, and early-stage conditions flood these centers. Beds are filled with cases that could have been addressed much earlier, if only the system's foundation were stronger. And that foundation is primary health care. Across Nigeria, PHC facilities are meant to be the first point of care. They should manage common illnesses, provide maternal and child health services, run immunization campaigns, and ensure that emergencies are caught early. Yet, many of these centers operate without sufficient staff, inadequate equipment, and limited operating hours. Patients arriving after hours often find closed gates. Health issues that should be resolved at this level escalate into life-threatening emergencies. It is here that the missing link becomes apparent. For decades, Nigeria has trained a cadre of highly skilled professionals designed to bridge the gap between communities and higher-level hospitals. Community health extension workers, CHOs, and community health officers, CHOs, are equipped with the knowledge, skills, and certification to provide comprehensive primary care. Their role is simple in theory but profound in effect: to prevent disease escalation, treat early, and reduce pressure on secondary and tertiary facilities. Yet, in many parts of the country, these professionals remain underutilized. Hospitals overflow, while trained hands capable of addressing the majority of cases remain on the sidelines. CHOs and CHOs are sometimes unrecognized, sometimes unemployed, and occasionally constrained by the very facilities that are meant to support them. The disconnect is evident. When the missing link is absent, patients suffer. When it is present, communities thrive. Where CHOs and CHOs are empowered and operational, outcomes are strikingly different. Routine immunizations reach every child. Expectant mothers receive timely antenatal care. Early-stage infections are treated promptly, preventing complications. Local outbreaks are managed before they become widespread. And, most importantly, fewer patients need to make the exhausting journey to tertiary hospitals. The system begins to work as intended. Empowering these community health workers does not require invention. It requires recognition, resources, and deployment. PHC centers need staff, equipment, and continuous operational hours. CHOs and CHOs need to be placed where their training can make the greatest impact. Communities need awareness that competent, trained care is available within reach. These steps can dramatically reduce overcrowding at hospitals, save lives, and restore public confidence in the healthcare system. It is not only about reducing numbers, it is about restoring dignity and access. Families should not have to fear that a minor illness will become a fatal event due to systemic inefficiency. Hospitals should not be forced into impossible triage decisions because beds are filled with cases that could have been addressed earlier. By empowering CHOs and CHOs, Nigeria can realign its healthcare system, ensuring that tertiary care is reserved for those who truly need it and that early interventions happen at the community level. The impact is already visible where these workers operate effectively. Communities with functional PHCs staffed by CHOs and CHOs report fewer emergency admissions, higher vaccination coverage, and improved maternal health outcomes. The presence of trained professionals transforms health outcomes, providing tangible proof that the solution exists. It has always existed, but needs activation. As Nigeria looks to the future, the message is clear. Tertiary hospitals are not failing because doctors and nurses are incompetent. They are failing because the system's foundation has been weakened. The missing link, the trained, skilled, and ready CHOs and CHOs, remains underutilized. Recognizing, empowering, and deploying them effectively could be the change that prevents needless deaths, reduces overcrowding, and restores balance to the nation's healthcare system. In the end, the solution is both simple and profound. The health of a nation is measured not by the grandeur of its hospitals, but by the strength of care that begins at its foundation. When communities are served, early interventions happen, lives are saved, and the pressure on tertiary hospitals eases. CHUs and CHOs are not just a part of the system. They are the missing link, the bridge between illness and timely care, between despair and hope. Across Nigeria, the difference is waiting to be made. The hands are trained. The knowledge exists. The solution is here. It is time for the missing link to be fully recognized, fully empowered, and fully deployed. Because when that happens, lives will be saved, hospitals will breathe, and a healthier nation will emerge.